I'm not dying of cancer, I'm living with it.
Kelly's been treated at Dana-Farber Cancer Institute for 6 years for metastatic breast cancer. But living with cancer means Kelly is living with a lot of pain.
So I'm feeling a lot more now than I ever did. And some days are real tough.
Kelly also has a history of substance use disorder. She's candidly sharing her story and her struggles with addiction, along with the challenges of now balancing her past with her need for pain management for her cancer.
You know, sometimes I'd have to ask some tough questions. I was worried at times.
Dan Gorman is a palliative care nurse practitioner who helps manage Kelly's medications. He says his profession has changed a lot in recent years.
I think, you know, those of us in palliative care, we are not trained in addiction management. However, over the last 3 to 5 years, we've all had to get a bit more savvy in understanding how to care for complicated pain patients as well as patients with opioid use disorders.
We actually have some tools that are just questions that we ask patients, and we can even assign a score that gives us a sense of how likely this person is to have trouble with misuse of opioid medication if we prescribe it.
Dr. James Tulsky is the chair of the Department of Psychosocial Oncology and Palliative Care. He says patients prescribed opioids sign a medication agreement and are closely monitored. Depending on their risk assessment, their care might be co-managed with an addiction management specialist. Other options include giving 1-week prescriptions or toxicology screenings. For patients like Kelly, she says it's not always easy, but the approach is working.
I just want to thank Dana-Farber in itself, like in the whole. I don't think without them I'd be where I am today, and I am so grateful.
Dr. Tulsky says more education is needed for clinicians to better understand how to manage patients with addiction disorders. He also says there's a need for sensible regulation that balances the pain needs of these patients with these powerful medications. For Dana-Farber News, I'm Victoria Warren.